Hello, myself Dr. Puvvada Sandeep, consultant urologist, transplant and robotic surgeon from Ramaya Memorial Hospital, Bangalore. Today we'll discuss in brief about the benign prostatic hyperplasia which every man goes through in his lifetime.
Who all are at a greater risk of developing benign prostatic hyperplasia.
It's usually seen in patients who are elderly age, that is above 50 years of age, and if they have any family history which is significant, like any of the family members are suffering from the same. And the third most important thing is it is seen in any patients who are having comorbidities such as diabetes, hypertension, or heart issues. And the other risk factor being if the patient is obese, who is overweight, and in few races of other races also it is seen.
What are the various tests which can help diagnose benign prostatic hyperplasia?
There are various tests which can be performed in a patient to diagnose BPH. First of all, the clinical examination is most important in this. By doing a digital rectal examination and based on the patient's symptoms, we can diagnose a prostatic enlargement. And subsequently, we will be subjected to various tests such as the urine routine test, which shows any infection is there, and then followed by an ultrasound scan that shows the exact size of the prostate gland, what is enlarged, and what is the size of the prostate. And the other important finding which we can get from the ultrasound is if there's any altered echo texture, is there any changes like cancer is seen in that, and what is the amount of urine which is staying back after the patient passes the urine. Then the other test would be to do uroflowmetry. That is a flow test which the patient passes urine in a machine in an electronic commode, which will give us the recordings like at what rate is passing the urine, what is the quantity is passing, and after passing the urine, how much of urine is staying back inside. Then comes the other blood test, that is serum PSA. That is called as a prostate specific antigen test. That will tell us if the prostate enlargement is turning to be a cancerous. Beyond this, if anything is suspicious of cancerous, then further tests like MRI also will be done.
Is there any association of benign prostatic hyperplasia and prostate cancer?
The benign prostatic hyperplasia is nothing but a normal enlargement of the prostate gland, which is seen with advancing in age. Yes, there is a possibility of it turning to be a malignancy, that is prostate cancer. So there are about 10 people out of 1 lakh population usually go through this. And this is the second highest malignancy which is noted in men. So to a certain extent, if the patients are having a BPH and if they're kept on close follow-up, this can be diagnosed earlier. Or if the patient comes in the advanced stage, then we can be diagnosed with multiple tests.
What are the treatment options available for patients with benign prostatic hyperplasia?
The treatment options include both medicines and surgical options. Coming to the medicines, there are simple one medicine which is taken in a day that usually covers the patient's symptoms for 24 hours, and it is usually given in the night times for the patient, help him in reduce the frequent urination what they get up in the night times or the urinary disturbances whatever they have. And most of the people, around 50 to 60% of the population, they respond to the medical line of management. In case if we don't find the improvement in the medical line, then we'll be suggesting the patient to go for surgical line. That is if they develop any further complications and not responding to the medical treatment. And the various surgical options include the laser, without the laser, and now we have very minimally invasive techniques like vaporization of the prostate and the laser. All these techniques are available now to treat the prostate. And the patient needs a very short hospital stay of about 48 hours to 72 hours. And after that, they can be discharged home. And the symptoms, they get immediate relief with the surgical procedures. Thank you.